This solution is used to prevent and treat rejection of a kidney transplant. It belongs to a class of drugs known as immunosuppressants. It works by decreasing your body's natural defense, the immune system. This helps prevent your body from rejecting the kidney transplant so it can work normally. The dosage and timing of this medication will be determined by your doctor based on your medical condition and response to treatment. Be sure to take it exactly as prescribed. Before taking anti-thymocyte globulin, rabbit, your doctor may instruct you to take other medications to reduce potential side effects. This medication will be administered by a healthcare professional according to your doctor's instructions. The dosage will be determined based on your weight, medical condition, lab results, and how you respond to treatment. It will be slowly injected into a vein, usually over 4 to 6 hours. If you experience redness, pain, or swelling during the injection, notify your doctor or nurse immediately. It's important to follow your doctor's guidance on taking other medications to prevent your body from rejecting a kidney transplant or to prevent infection. If you're unsure how to take any of your medications, consult your doctor or pharmacist. If you experience nausea, fever, chills, diarrhea, dizziness, headache, tiredness, redness, pain, or swelling at the injection site, it's important to tell your doctor promptly. It's possible for people using this medication to experience serious side effects, but your doctor has prescribed it because the benefits outweigh the risks. Your doctor will monitor you carefully to decrease your risk. Be sure to tell your doctor right away if you experience any serious side effects, such as easy bruising/bleeding, fast/irregular heartbeat, joint/muscle pain, severe stomach/abdominal pain, or weakness. Since this medication weakens the immune system, it may lower your ability to fight infections, making you more susceptible to serious infections or worsening any existing infections. If you notice any signs of infection, such as cough, sore throat, fever, chills, or pain when urinating, contact your doctor immediately. Using this medication may also increase your risk of developing certain types of cancer. It's important to consult your doctor for more details. While a serious allergic reaction to this drug is rare, seek medical help right away if you experience symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you experience any other effects not listed above. Before taking anti-thymocyte Glob, rabbit, solution, Reconstituted, Recon Soln, make sure to inform your doctor or pharmacist about any allergies you may have, especially if you are allergic to rabbit proteins or have had a severe reaction to other immune globulins. This medication may also contain inactive ingredients that could cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. It's also important to inform your doctor about your medical history, particularly if you have any bleeding or blood clotting problems, or if you currently have an infection. This medication may cause dizziness, and using alcohol or marijuana can intensify this effect. It's important to avoid driving or using machinery until you can do so safely, and to limit alcoholic beverages. If you are using marijuana, be sure to talk to your doctor. Anti-thymocyte Glob, rabbit, solution, Reconstituted, Recon Soln, can also increase your risk of getting infections or worsen current infections. It's important to avoid contact with anyone who has a contagious infection, such as chickenpox, COVID-19, measles, or the flu. If you have been exposed to an infection, be sure to consult your doctor. Before receiving any immunizations or vaccinations, it's important to inform your healthcare professional that you are using this medication. It's also important to avoid contact with people who have recently received live vaccines, such as the flu vaccine inhaled through the nose. To lower the risk of getting cuts, bruises, or injuries, it's important to be cautious with sharp objects like razors and nail cutters, and to avoid activities such as contact sports. This medication may increase the risk of developing skin cancer, so it's important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. Your doctor may also advise you to avoid phototherapy while using this product. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, this medication should only be used if clearly needed. Be sure to discuss the risks and benefits with your doctor. It is also unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. When taking Anti-Thymocyte Glob, Rabbit, solution, Reconstituted, Recon Soln, it's important to be aware of any potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's also important to avoid starting, stopping, or changing the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include other drugs that weaken the immune system, such as azathioprine, cyclosporin, and cancer chemotherapy. It's important to communicate with your healthcare team about all the medications you are taking to ensure there are no potential interactions. Additionally, this medication may interfere with certain lab tests, possibly causing false test results. Make sure to inform lab personnel and all your doctors that you are using this drug to avoid any complications with lab tests. Remember to follow your doctor's guidance and take the medication as prescribed for optimal results. If you suspect an overdose and the person is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical assistance by calling 911 or a poison control center. In the United States, you can contact your local poison control center at 1-800-222-1222, and in Canada, residents can reach out to their provincial poison control center for assistance. While using Anti-Thymocyte Glob, Rabbit, solution, Reconstituted, it is important to undergo lab and/or medical tests, such as complete blood counts. Make sure to attend all medical and lab appointments and consult your doctor for more details. Make sure you take this medication exactly as your doctor has prescribed. If you happen to miss a dose, be sure to consult your doctor or pharmacist for a new dosing schedule. It's important to keep up with the recommended dosage to ensure the medication's effectiveness. You will need to visit a hospital or clinic to receive this medication, as it is not meant to be stored or taken at home. Anti-Thymocyte globulin, Rabbit, solution is used to treat and prevent rejection of transplanted organs. The dosage and timing of this medication will be determined by your healthcare provider based on your specific medical condition and response to treatment. Make sure to follow their instructions carefully. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.